Hi there, welcome to our pharmacy revision series by CBH Education. Today we're going to talk about non-steroidal anti-inflammatory drugs. Now, these are used for a variety of indications for pain, chronic pain, and predominantly osteoarthritis. The mechanism of action is it's a non-selective COX-1 and COX-2 inhibitor, which basically inhibits prostaglandin synthesis. Side effects include GI bleeding, headaches, drug interactions, ACE inhibitors, lithium and methotrexate are the common ones, and key monitoring is urea and electrolytes. Now, when we're looking at NSAIDs, things to help you with your revision or areas that you come across in clinical practice is that it needs to be co-prescribed with a PPI. So if you are taking it short term or for a specified duration, you need to have that PPI there to reduce the risk of the stomach side effects and obviously a gastric bleed. This should be used for the shortest time possible. You need to understand about the key interactions and potentially nephrotoxicity. So as discussed in the first slide, methotrexate, lithium and ACE inhibitors. Advice about long-term use with patients as well. Now, a lot of work in general practice and even in community pharmacy does audit this kind of work, and you really need to make sure that patients do understand the long-term implications of this as well. Now, in elderly patients, it's best to avoid prescribing these completely. Patients who may have an NSTEMI, they may be on aspirin, and obviously, as you know, aspirin historically has been indicated as an antiplatelet, and that may be co-prescribed with methotrexate as well, but that's usually specialist initiated. And in our methotrexate presentation, which we've covered, we've talked about some of the key monitoring there, and that is done routinely in GP surgeries every 3 months. And you've got to make sure that patients are warned of the risk of this as well. Thank you very much for listening to this presentation on NSAIDs. Please follow us on our Facebook channel, Instagram and YouTube for further videos on the different types of drugs, mechanisms of action and key revision points.